In January of 2020, the first case of COVID-19 was reported in the United States. A couple months later, the president declared a national emergency, and the country went into lockdown. Over the next 18 months, COVID-19 would become the deadliest pandemic in US history, claiming more lives than the 1918 Spanish flu. As the virus spread through the population, a trend became increasingly clear. The most vulnerable communities were disproportionately affected by COVID-19. They had 18% more infections, 75% more deaths, and 17% fewer vaccinations per 100,000 people than the least vulnerable counties. The rapid spread of COVID-19 forced government and nonprofit agencies to quickly respond by appropriately distributing funds to communities most in need of assistance. In 2014, the CDC measured how vulnerable each census tract was to hazardous events, just like COVID-19. This metric is called the Social Vulnerability Index, or SVI. The overall Social Vulnerability Index is calculated as an aggregate of the individual SVIs determined for 4 themes based on census data: socioeconomic status, household composition and disability, minority status and language, and housing and transportation.
Our team wanted to know if there was a difference in how communities at various SVI levels were affected by COVID-19. As COVID-19 data is widely available at a county level, we decided to roll up the census tract level data to the county level. We then calculated an overall SVI for each county in the US. With this county level data, we're able to visualize SVI for the entire United States. The dark red shows counties with higher social vulnerability, while the yellow indicates less vulnerable counties. At the state level, we're able to clearly see the differences in vulnerability between counties. These 4 maps show the vulnerability by county in North Carolina for each of the 4 themes that go into computing the SVI. Now let's take a look at SVI in combination with COVID-19 data to see the varying impact of the pandemic. From here on, all metrics will be reported per 100,000 people in the county.
First, we'll split up SVI into 3 vulnerability groups: low, moderate, and high. Any county above the 90th percentile for vulnerability was classified as high, and 10th percentile or lower was classified as low, and in between was classified as moderate vulnerability. If we plot the number of infections for each vulnerability group starting in January of 2020, a clear pattern emerges. The most vulnerable counties in the US experienced the greatest number of infections. As of September 2021, there were 18% more infections in high vulnerability counties than in low vulnerability counties across the United States. When we repeat the previous process for the number of deaths, we see a similar pattern. As of September 2021, 75% more people have died in high-risk communities than in low-risk communities. The most vulnerable counties have the highest COVID deaths and infection rates in the country.
When we plot the number of vaccinations, however, the data showed that counties most affected by COVID have a 21% lower vaccination rate than counties least affected by COVID. However, if we filter SVI by the housing composition and disability theme, we see an interesting trend. Vaccines began rolling out in late 2020, and as time progressed, highly vulnerable counties saw a lower vaccine rate than their peers. As of September 2021, half as many people in high vulnerable counties were vaccinated relative to their low counterparts. This stark difference in vaccination rate appears to be similarly reflected in the steadily rising death rate for the vulnerable counties in this theme. As the Delta variant ravages through the US, low vulnerability counties appear to show a slower increase in the cumulative number of deaths compared to those in the high vulnerability.
In light of the varied impact of COVID-19 across different vulnerability groups, we were curious to see how federal aid was distributed to different counties. This visualization highlights average money distributed per capita to counties across vulnerability groups. Our analysis shows that for the most part, federal aid was appropriately distributed to the counties that were most in need. Our findings suggest that in the event of future outbreaks, the Social Vulnerability Index is a good starting point for political leaders and nonprofit organizations to use in determining which communities will have the greatest need for assistance. In order to get a more granular picture at which communities are most vulnerable to COVID's impact, we have built a dashboard to aid decision makers.
Our full dashboard is linked in the description. You will be able to look at data on a state-by-state basis, as well as filter by the different SVI themes, and visualize the impact of COVID by vulnerability groups. As you can see, COVID disproportionately impacted high vulnerability counties, resulting in far more infection, far more deaths, and fewer vaccinations than their low vulnerability counterparts. Distributors of COVID relief aid have clearly considered this vulnerability differential and have taken action to provide vulnerable counties with additional aid. Using our dashboard, policymakers can better distribute financial resources to mitigate the impact of future pandemics.